If you are keeping up with the US news, then you know that Trump has signed several executive actions which will have detrimental impacts on healthcare in the United States. So let's talk about it. As of yesterday, the United States has officially withdrawn from the World Health Organization, as well as the Paris Climate Agreement. Additionally, Trump has essentially halted all migration at the Mexico-United States border, as well as ended all diversity, equity, and inclusion programming. Trump has also mandated for all federal employees to return to in-person work. He has also revoked an executive order that would lower the cost of prescription drugs for people with Medicaid and Medicare. Trump has expanded the death penalty. He's implemented a federal hiring freeze, and he's pardoned about 150 January 6 offenders. These are just a couple of things that went into effect as of yesterday, so let's talk about them. Withdrawal from the World Health Organization, also known as the WHO, could significantly impact healthcare by weakening the U.S.'s ability to respond to global health threats such as pandemics and emerging diseases, and it may also hinder collaboration on critical health initiatives, limit access to global health data, and even disrupt disease surveillance systems. It could also reduce funding for public health programs, addressing issues within infectious disease prevention, maternal and child health, and vaccine distribution. Withdrawing from the Paris Climate Agreement could have detrimental impacts on climate change, which could have several health implications, including increasing respiratory illnesses, increased heat-related conditions, and even the spread of vector-borne diseases. The exiting of this agreement basically will lead to weakened environmental regulation, which could potentially worsen public health outcomes, leading into immigration crackdown and restrictions on birthright citizenship. Increased enforcement at the border, as well as denial of birthright citizenship, could deter immigrants from even seeking healthcare to begin with. It could be out of fear due to deportation as well as legal repercussions, and this could lead to worsened health outcomes for undocumented people in the United States. The elimination of DEI programs could potentially lead to reduced efforts to bridge healthcare inequities within marginalized communities, especially for racial and ethnic minorities, people who are part of the LGBTQ+ community, low-income populations, and immigrant populations in the United States. With the revocation of the prescription drug executive order, this could increase costs of medications for people on Medicare and Medicaid, which could have detrimental effects on their health and livelihood. This is only the beginning of a very long 4 years to come. You are currently a student with a marginalized or underrepresented background who is hoping to get into healthcare. Your voice is needed now more than ever. And I just want to reiterate that you matter, your career matters, and the impact that you will have in the future matters. As a Latina in healthcare, my heart currently breaks for so many families and people whose futures will be affected by everything going on. The hope right now is that a lot of these executive orders and decisions made by President Trump will be checked, but we'll see what's to come in the next year.